I think that's why I appreciate conversations with people like you that are in the field,
Mm.
but are also quite conservative for what they would recommend, because they realize that adverse effects can be quite common if you're not screened for, mental health troubles, that maybe you won't find success in these, and maybe you could
Mm.
benefit from many other modalities before diving into psychedelics. Because I really turn away from people who like will always call them, these are always plant medicines and everyone should take them, and they're like, I think we just need caution around all of these things, where it
Yes.
yeah, and so I really would love to understand how it's going, and if you could be the head of the authority in Australia for licensing these, what would
Watch
be?
out, everybody.
Yeah, look out. um what, how would you like to see this space develop?
Oh, my future self longs for the day where this could actually be an option for first line treatment, first and foremost. But, will
Right.
that happen? I don't know. Um, my lesser ambitious goal is to really see access broadened. I've read a few of the research papers around how helpful these medicines are for eating disorders. Anybody that works in mental health field in any way, shape, or form knows that eating disorders are some of the most complex and difficult disorders to treat. And
Mm,
some of the research findings have just been outstanding. We know
wow.
that addiction is on the horizon in terms of some of the clinical trial research coming out. I would love to see addiction added to the list of people that can access these medicines too. So, really, my first thing is to see the scope broaden of the presentations that we can treat with these medicines. As
Right.
you mentioned before, around the safety profiles, they're there, but these plant medicines are contraindicated by some health conditions, some medication, some predisposed family history of different disorders. So we need to be very careful.
Right. Yeah, because I imagine it's quite fraught with risk if someone wants to use it for substance abuse, but we're looking at these substances as the ones that are being abused, where it's typically
Mm-hmm.
not. And well,
Mm-hmm.
I mean, I do know plenty of people that are completely addicted. Not plenty, but enough people that are addicted to ayahuasca. For example, they'll go once a month, or they're addicted to mushrooms, and and I don't know if it's addiction like, let's say, a drug as perilous as cocaine, for example, but it's addicted to searching, or addicted to being in um, that realm
Altered
of
state. Mm-hmm.
altered state. That's a yeah, exactly. So yeah, so I can see how that would be troubling to be able to, because you have to figure out, okay, this person has been addicted to these several substances for this long. What dose do
Yeah.
we give them of this new substance? Like, it kind of seems counterintuitive. And have you seen?
Mm-hmm.
Well, I guess you haven't treated anything like that. So have you seen people that have tried to use it for substance abuse?
Yeah, well, as you mentioned, like some of my clinical practice is around addiction. Lots of my patients have had their own experiences with quite heavy substances, cocaine, heroin, MDMA, things like that, and they have asked me about how psychedelics can be helpful in treating addiction in that way. And we always go down the conversation of, in Australia it hasn't been approved for that use, but the
Right.
research shows that it can be helpful. There's always an education component to that, but then also reminding the patient of, this is risky, and you've had these experiences before where you have abused or misused these medicines in different ways, and then they've led to either a psychotic episode, or they've led to high levels of suicidal ideation, or they've led to really deep depression. So people need to be incredibly careful. Again,
Right.
always go back to your doctor, have a conversation with your doctor. If your doctor doesn't know, talk to your psychiatrist, talk to your psychologist, talk to your therapist. Somebody will know. If they don't know themselves, they will find somebody that can give you an answer.
Right. Well, that's great. I mean,
Mm.
I appreciate all of your work on this. And before we start talking, you said that you've been the first clinic that was granted legal status to administer these in Queensland, Australia.
Mm.
And
Mm.
so, congratulations on that. It seems like you're so passionate about your work. I think I'm sure your clients, your patients are safe and happy to be in your care.
It's incredible, and we're so proud to be able to bring access to our local community. You know, it's much needed. It really is.
And what would you say to people out there? Yeah, yeah, actually, it's hard because if everything's illegal, then it's hard not to say something positive
It
without.
is.
Yeah, so I'll let you take it. How would you like to end for all the people out there that are interested in this conversation in different countries?
Thanks for listening this far. If you haven't watched the Netflix series of Michael Pollan, How to Change Your Mind, do so. It's incredible. If you're a bookworm, go read the book. It's in so much more depth than the Netflix series. You know, if you are interested in the learning more about ketamine, there was a documentary on Netflix. Can't remember, something about Maya, it might have been called, and it's about a young girl that had a pain disorder, but she was treated with ketamine. And the family talk about how helpful that was in managing her pain. So again, these are sort of some resources and areas you can go to start really learning, and I guess helping yourself expand your own awareness as to what the potential could be with these medicines. Again, Mind Medicine Australia have a list of retreats that are run by doctors in legal settings around the world, that may be able to support you. Please jump on that website, look for those clinics, and reach out to them. If you do choose to go in the underground, please be safe. And if anything, if you need support, find a local psychologist in your area that can help you navigate thereafter to really integrate properly. I wouldn't recommend underground, but if that's what you feel you need to do, then please just go with care.